Did you know that nearly 70% of people will complain of weight gain with certain medications? That's a lot of people, and it's a much more common problem than you think. I'm Dr. Banasali with Plant Forward MD. Join me today as we talk about medications that could cause weight gain. What do you do if you gain weight on them?
Well, there are actually a few strategies you could try. We'll get to those in just a bit.
You were hoping to lose weight, or at least not gain any, when you started a new medication. And yet, no matter what you do, whether it's eating well, sleeping well, reducing your stress, doing exercise, you're noticing that the scale is just going up. And no matter what you do, nothing is fixing that. It's frustrating. And the whole point of taking a new medication is to help a problem or to prevent a problem. And here you are having a new one because you know that everybody's going to tell you that you need to reduce your weight to reduce your risk of diabetes, blood pressure, fatty liver, and a host of other problems. And yet the scale won't budge. So today, let's talk about some common medications that can cause weight gain. Pay attention to number 4. It's not one that a lot of us think about when we think about medications causing our weight to go up, but we use it pretty commonly nowadays. But the first group we're going to talk about is antidepressants. So antidepressant medications are used pretty commonly nowadays. Whether it's to improve mood, improve anxiety, sometimes even for chronic pain, there's a lot of different uses, and there's a lot of different ones out there. There was a recent study in 2024 that showed that there was weight gain with several different antidepressants. What they did was they compared Zoloft, which is a very common antidepressant, to 7 other ones that are commonly taken. And they checked in on people and saw that there was weight gain specifically at the 24-month mark. So who gained the most weight? Well, it was the people on Lexapro who gained about 3.5 pounds at the 24-month mark. That's not a whole lot of weight when you think about it. But remember, this is an average. So some people may have gained a lot more than that, and some people maybe not at all. This is the list of the different weight gains that was published. Now remember, sometimes when you're depressed, you don't feel like eating or moving. So there's definitely a decrease in calories, there could be a decrease in muscle, and so an overall decrease in weight. And when you're feeling better, you could be eating more. So that's just one mechanism. Could it be the drugs themselves? Yes, it could be in certain ways. But half the battle is knowing that it could cause weight gain so that you can talk to your doctor, talk to your psychologist, and see, are there other ways that we can go around this? Can I accept a couple pounds? Or maybe if it's too much weight gain, then I'm gonna have to switch to something else. They even looked at Wellbutrin, which is a pretty common medication that a lot of people are being switched to when weight gain is an issue because it doesn't cause as much weight. And they saw there was a slight increase, but it wasn't right away, it was much later on. And there was something else to think about. There's more and more data coming out on the gut microbiome and mood symptoms and depression and how it can affect it. So antidepressants can perhaps alter the gut motility, gut secretions, the microbiome composition, and therefore affect your mood the other way. So they're looking at different probiotics or medications that could help improve the gut microbiome and therefore maybe improve mood. But remember, this all plays a role in metabolism. The second group of medications that we want to talk about are corticosteroids. I have to admit, I prescribe a lot of them because I'm a rheumatologist, autoimmune specialist, and they do help calm down the immune system. But we have a love-hate relationship with them because we know there's a lot of potential side effects with them, one of them being weight gain. And sometimes it's not even the amount of weight you gain, but it redistributes it. So all of a sudden the weight is more central, like it's more in your face and neck and stomach, and nobody seems to want it there. So we do have, unfortunately, problems when we give this medication long-term. Now for the people who take a Medrol dose pack, one of those 5-day packs or maybe 7 days, it's not usually as much of an issue. And if you tell somebody that they're going to gain weight because their appetite's going to be really, really increased, most people will know to kind of hold back a little bit and maybe choose healthier choices. So it's important to know that corticosteroids could increase your weight. But if you're taking it long term, it's really hard to reduce weight, even sometimes maintain a stable weight. And not until you get down to a much lower amount of prednisone or whatever type of steroid you're on could you actually lose the weight. The issue with corticosteroids, though, is it's not just for inflammation. Sometimes you may have an infection, like a viral infection, a bronchitis, and while the bacteria is gone, the virus is taken care of, you have these lingering symptoms, and it's this subtle inflammation, so you get the steroids from your doctor for even treating it. It's kind of more of an indirect way to treat it, but sometimes you get it for that reason. And so you can see that steroids are very prominent when you go to the emergency room or you get sick and go to your doctor. So be careful with weight gain there. Hopefully it's just temporary amount of steroids. Our third group is anticonvulsants, or like anti-seizure medications, but they're not always used for seizures. For example, in rheumatology, we use them a lot for pain. Medications like gabapentin or Lyrica, also called pregabalin. So those medications in my field, we use them more for pain, and they can cause more fatigue, drowsiness, fluid retention. They can increase the fat storage, maybe decrease the metabolism. So a lot of issues even while they treat the pain. Now, usually it's not a whole lot of weight that you can gain with Lyrica. I mean, I have definitely seen some examples of people gaining a lot and some people barely at all. You kind of have to see if it affects you, because if it doesn't, they may be great medications for you to continue. And if it does affect you, then can you do anything about it? Can you choose to eat better, to move more, and does that make a difference? Number 4. Antihistamines. Like I said, we're using them much more. It's a problem. In Florida, I definitely feel like people are using them all the time. And very commonly, they use Zyrtec, also called cetirizine, can increase your drowsiness. That's about 10% of people. And if you're more drowsy, you're gonna move less and therefore not get enough activity. Yes, but it also can stimulate your appetite because it blocks histamine. And so it increases appetite, so you could gain weight from that as well. Luckily, this is usually people who use it long-term on a daily basis. So if you have an allergic reaction or just temporary allergies and you're using it, it's likely not going to be as much of a problem, but long-term, definitely some people have this as an issue. The last group that we're talking about today is biologic medications, which I use a lot of, and it's being more and more commonly used in different specialties, not just rheumatology, but also gastroenterology, pulmonology, dermatology, a lot of biologic use out there. Do they cause weight gain? This is not a common side effect of the biologic class of medications, not for rheumatology at least, but we do see it once in a while. Now, what are the different reasons that it can happen? Well, first of all, when you don't feel well, you're probably moving less and maybe eating less. And so now that you have this biologic medication and you're taking it successfully, you're feeling better, you're eating more, maybe you're socializing more and therefore eating more, and you're moving more, maybe you're building muscle mass. So that's definitely a possibility. The other possibility is maybe you have some other autoimmune disorder or another condition like low thyroid or hypothyroidism, because with that there's definitely association with weight gain, and we see it more commonly in certain groups of people like autoimmune patients, but also other people. The third thing, in a biologic, for example, like an anti-TNF drug, you may have heard of Enbrel, Humira, there's a whole class of them, you can get heart failure and that can retain fluid and cause an increase in weight. So you definitely want to make sure it's not something like that. And number 4, could it be the drug itself? Even when they say a drug is less likely to cause weight gain, there could be that small percentage of people that it does affect. I've been practicing rheumatology almost 15 years, and I have a definite 2 cases which I can say were because of the anti-TNF class of medication. And in both of these patients, I give this medication and it's like a 20-pound increase in weight. We go through all the possibilities of weight gain, right? Because you don't jump to that as your first idea. It's not as common. But we rule out all the other things and there's nothing else. And my patient wanted to get off the medication and we did it. And it was a sudden loss of the 20 pounds that were gained in both of these instances, like over a couple months, not a few weeks, but there was no other change made. So yes, I have seen it. And more recently, I saw it in somebody who takes a medication called Rinvoq, which is also used in not only rheumatic conditions, but also in the GI world and in the skin condition world. So these medications, even though it's less commonly associated, if there is no change in anything else that you've done, it's worth considering if it could be related to the medication. Oftentimes, if you stop it and the weight goes back to normal, then you know, if nothing else was changed. Okay, so we talked about several different classes of medications. What do you do if you gain weight on them? The first thing is if it's entirely at all possible, don't start more than 1 new medication at a time. Sometimes you don't have a choice. Something has happened, a stroke, a heart attack, and you need to take all these new medications together. And it's kind of hard to tease apart what's causing the problem. But if at all possible, try just starting 1 medication at a time so you can tell if it was because of that you gained some weight. Number 2, if it's a medication that causes weight gain, but it's a temporary weight gain, such as corticosteroids, then try to do the best you can for those few days that you're taking it, whether it's watching your weight or exercising more, knowing that you're going to be off of it soon, because the medication may be necessary for you to take, and it may not be a good idea to just stop it abruptly. Just try to do the best you can. Number 3, make sure it's not another condition being masked that's causing weight gain. Like we talked about with the thyroid, but there's also heart failure and there's other conditions that can cause fluid retention, right? So your fluid is retaining in the body and that also can cause your weight to go up. Metabolism is a problem as you get older, menopause symptoms, premenopausal, perimenopausal symptoms, amongst others. Just make sure it's not something else that's causing the weight gain before you think of looking at your medication. But the medication is always a possibility, the way I look at it. And it's different for every person on how much that they gain or lose on a certain medication. So remember to look at your pill box, your medicine cabinet, and see if that could potentially be causing you new problems. Have you ever gained weight from a medication causing you to stop it? Drop it in the comments. I'm Dr. Banasali with Plant Forward MD. See you next time.